This is Leanna Babb, RN, with my PowerPoint presentation, Renal Failure, It's About Options, for Nursing 442 Spring Arbor University. Kidneys are an intricate part of the body's filtration process. Blood moves through the kidneys and wastes are removed and then excreted from the body through urine and sweat. Without this filtration, the body would begin end-stage kidney failure, which is fatal without artificial filtering, dialysis, or kidney transplant. To evaluate the effectiveness of the renal system, blood tests are performed. These blood tests calculate the estimated glomerular filtration rate, or GFR. An expected GFR for a healthy adult is greater than 60 on a laboratory report, but kidney failure is indicated with a result of less than 15. It's risky business. The majority of society is born with two functioning, healthy kidneys, but as people live their lives, they may be exposed to risks which can lead to renal failure. Renal failure can affect anyone, but the burden of CKD continues to increase in low to middle income countries globally. Some conditions which are risk factors for renal failure are diabetes, hypertension, cardiovascular disease, HIV infection, immunological disease, or having a family history of kidney failure. These would all be chronic conditions that lead to renal failure. However, it is important to recognize that a motor vehicle accident can also cause acute kidney injury, which may lead to renal system failure. Where does it all begin? The kidneys are built to filter wastes. However, certain stressors on the body inhibit the ability of kidneys to perform their filtration duties effectively. Diabetes causes the blood to become thick and sludgy, whereas uncontrolled hypertension puts excessive unhealthy pressure on the blood vessels and thereby the kidneys. When a body is constantly rife with infection, then the kidneys are overworked in their burden. Providing the kidneys with ample hydration and limited pressure allows them to function at an optimal rate. Look for the signs. Renal failure that is chronic manifests itself slowly over time, and unfortunately, no symptoms are seen until the GFR is significantly reduced. This makes the prevention of renal failure even more important. There are a few signs or symptoms that acute renal failure reveal, such as fatigue, swelling, and reduced urine output. If these signs are seen soon enough after a traumatic injury, then intervention needs to occur to restore renal health. Can we fix it? With acute renal failure, often the symptoms can be treated and homeostasis can be regained. However, with chronic renal failure, there is no easy fix. There are two major options for filtering the blood of a chronic renal failure patient: kidney transplant or dialysis. Neither option is a permanent solution, but both can provide improved quality of living and lengthened lifespan. Kidney transplant is the preferred choice for children. It has been found that children who received a kidney transplant before 18 years of age and who maintained graft functioning for at least 10 years had a favorable social and professional outcome. Getting a kidney transplant requires locating a donor, risky surgery, and continued care after surgery to ensure the replacement organ is not rejected. The second option is dialysis. This can be either hemodialysis or peritoneal dialysis. Dialysis is very time-consuming, exhaustive, and expensive. So it is important that patient's family participate in the education sessions and support the patient as they work with their physician in selecting the renal replacement therapy that best supports their lifestyle and healthcare goals. The patient, their family support, and future future goals are all taken into consideration when choosing a treatment plan. Is that all there is? Renal failure is a scary diagnosis, whether acute or chronic in nature. Disease management can lend toward lessening the risk of developing renal failure. By becoming educated and informed regarding treatment and overall health, a patient can take important steps toward living a long, healthy life. Thank you for watching my PowerPoint presentation on renal failure. For more information, please access the references listed here. Thank you.